Hello, everybody. This is our briefing today, April the 7th. We've got some good news to report and then just news in general. The best thing I can report is just this for today is, you know, I told you that I had 2 straight days of relatively the same question. And the question was primarily this: what are we going to do about workforce from the standpoint of processing these unemployment claims, and we're being overrun by them? And I've said over and over and over, and I want everybody at workforce to hear me loud and clear, I appreciate all the good work that they were doing, and they were absolutely overwhelmed. We had 90,000 claims in the month of March, and a typical March would have been 3,400 claims. So through all that, there's been a lot of additional work go on. And like I said, when I left here after 2 days of questions, what are we going to do? You know, taking an aspirin for cancer wasn't going to help us. And so we had to really make a move. We had to make a real move. And so my instructions to Brian Abraham, my general counsel, was General Hoyer was working this diligently as he could be. But I said, whatever General Hoyer and workforce believe that needs done, triple it. Because these people are home, are hurting, and they're worried about paying the power bill and everything else under the sun, and we're going to fix it. And so today, I'm reporting 2 different things. You know, the number of claims that came in on April 1st were 6,736. And it ranged on April 2nd at 5,794, 5,794, 6,044 on April 3rd, 2,048 on April 4th, 4,010 on April the 5th, and 3,379 on April the 6th. So in other words, all of those days, we're ranging between 2,000 and 6,000 or 6,700 claims that are coming in each day. I very, very proudly can tell you that in one day, yesterday, we processed 28,500 of those claims. So we're catching up, and we're catching up really, really fast, and that's what we should be doing. Now, I also today want to announce this. And I'm going to read this to you. Today, Workforce West Virginia will begin distributing the additional $600 in federal pandemic unemployment compensation provided by the CARES Act for eligible unemployment claimants. So that's a big bump, and that's going to be additional monies to all of those that are out there on unemployment. They absolutely are processing the claims right now. Yesterday, we processed the 28,500 claims, which was nearly $20 million in benefits. And so, you know, we're finally moving. We've got it. It's a 24/7 call, you know, to where you can call in. We'll answer the questions, and I think you'll find that the people that are out there that are rightfully so really concerned and calling and not being able to get through and everything is just not acceptable to any of us. But we needed an extra nudge and everything. And so, you know, from the standpoint of commerce and Workforce West Virginia, and especially the Guard is really stepping up in every way. And we salute them all the time. We appreciate them in every way, but everybody's doing a great job in doing their stuff here, but the Guard is really stepping up, and we really, really appreciate them. So if I could go on to the next thing would be just an update on where we are. We've had no additional deaths. Thank the good Lord, you know, for that. We have a total now in the state of West Virginia of 412 positive cases. Our daily rate, now remember that number I would continue to tell you, about 4%, and the other states in the nation are tracking at 8 to 10, and New York at 30 to 50. but really and truly, yesterday we tracked again at 1.6%. And so that's even better than what we've been doing. Yesterday we were at a cumulative average of 3.47. Now we're at a cumulative average of 3.42. So it's going down. It's getting better. I salute all the great work that all the health departments and everybody's doing, but especially you as West Virginians and all the good work that you're doing with our stay-at-home orders and all of our businesses reacting the way that they're reacting and letting our employees work at home. It really is making a difference. I've said it until you're probably sick of listening to me say this, but our power is our ability to cripple this disease by staying away from one another and not letting it just jump from one to another. We're really making progress here. We're doing good stuff in West Virginia, but I always underline we are the highest risk state in the nation, and we're within a rock's throw of 2/3 of the population of this nation, so we could be contaminated so easily, so easily. So please stay the course. Keep doing what you're doing, West Virginia. I couldn't be more proud of you and everything. We've still got to be worried about what could happen, and it could be bad. So let's just stay the course and keep on doing what we're doing. I've got couple of things to report real quick, and that is just this. We've got a lot of questions that are coming into us and everything. Are we testing as much as the other states? Well, to be just straight up, between Kentucky, Maryland, Ohio, Pennsylvania, Virginia, and West Virginia, we are testing second only to Pennsylvania, and they are testing slightly a little bit more per the percentage of population. Now, I can't already see, forgive me, but from the standpoint of West Virginia, we are testing to percentage of population, 5.59% or 0.559% of the population, and the entire nation is testing at 0.592. So we're at 559, and the whole nation is at 592. And so we're almost step for step with exactly what's going on all across our entire nation. And as far as our neighbors, we're ahead of every state with the exception of Pennsylvania, and they're slightly ahead of West Virginia as far as testing per the percentage of population. Now, the greatest part of this whole story is just this. From the standpoint of all those neighboring states, Kentucky, Maryland, Ohio, Pennsylvania, Virginia, and West Virginia, we're at 3.47 yesterday. We're at 3.42 today, and that is the lowest of all of our surrounding states. And get this, we're at 3.42%, and the national U.S. average is at 18.51. So we're doing it, West Virginia. Stay ahead of the curve and keep on keeping on. Now, the other thing I'd like to report is we have this situation with one of our nursing homes, Eastbrook. I reported to you yesterday about that. We have tested now 124 of the patients and 39 staff. We have now 4 patients and 1 employee that have tested positive there. It's another nursing home situation to where we absolutely don't want this in a place where all of our elderly are. We're on top of it, but at the same time, we've got to be concerned about this. This is exactly where we don't want this to be, and we'll just stay on top of it. But it says all the remaining staff members have been contacted to set up appointments for their testing, and the health department has received 69 negative results from the facility. They have a total of 52 tests that are currently pending, and the pending tests do not include the staff members that are coming still for appointments. So we've got to get everybody tested and in order for us to be able to stay on top of that situation. But that's all I've got, other than, again, to just say to you that 4 deaths are 4 too many. We're staying on top of everything as best we can. I hope for all those that are out there that are wondering about your unemployment claims, you're pleased that we're really moving now, and you can see that a typical day for claims coming in of about 6,000, well, probably 2 to 6,000. And yesterday we processed 28,500 claims, plus the fact that now we have the go-ahead to turn loose the additional $600 per claimant. So you know, at least that's a little bit of bright news, and let's just stay the course, West Virginia, and I thank you.
Thank you, Governor. We're now going to view a video from the National Guard and Workforce West Virginia.
Well, Governor Justice had directed General Hoyer with the West Virginia National Guard to provide additional resources to Workforce West Virginia. As most folks know, with the COVID-19 pandemic, the unemployment compensation claims have skyrocketed to the tune of about 1,800% over than what we normally take in any given month for the month of March. And so the National Guard has provided additional resources in the form of bodies. And so we have folks from the National Guard Guardsmen who are taking calls, helping with applications for unemployment compensation, fielding basic questions, and also soon they will be processing unemployment claims. And so what that's allowed us to do is expand the capacity of workforce to accept those, the influx of unemployment compensation claims. It would be, I mean, in addition to the fiscal support of bodies in the chair and folks on the phones, the National Guard's provided vital logistical support in helping with building capacity for technology in conjunction with the West Virginia Office of Technology. So it's really important and vital to having the National Guard present here at Workforce, assisting with the unemployment compensation claims due to COVID-19.
And now let's go to Major General Hoyer.
Ed, one other thing, it's just a perfect example of how we're all pulling the rope together. I cannot thank Workforce enough, but I absolutely love what all the Guards are doing, and I can't thank them enough. And so we're all going to keep pulling the rope together. We're going to get there.
Thank you, Governor. Now let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 520 members of the National Guard on duty. As the governor pointed out and you saw in the video, we're surging from 15 to 30 guardsmen supporting Workforce West Virginia. First from call center standpoint, then to be trained, also cross-trained as claims processors. In addition to that, West Virginia University volunteered 10 people from their call center who are going through training this afternoon to also give us geographical dispersion in the call center capability. Just to give you an example, last night from midnight to 7 this morning, while the claims were being batch processed, National Guardsmen supported 803 calls from citizens in support of their claim status and information. In addition, yesterday, we had 23 retail training setups. Today, we're doing 46. In addition to the sanitation, decontamination, and PPE training, we've now added, at the request of the local county health departments, some advice and training for those companies how to space customers out, how to space lines out outside their facilities to, again, effectively keep the social distancing orders in place. In addition to that, we're ramping up additional support through drive-through testing lanes, and later this week in Wyoming County and Mingo County, the Guard will support testing lanes with local county health partners. As of yesterday evening for one day, our food bank personnel helped pack an additional 450 family meal packs, as well as deliver 3,000 meals to 3 counties. And then with Tamarack supporting our child nutrition program, delivered 15,000 meals to 2 elementary schools that are being supported by Tamarack. A great example of what the governor's directed us to do is to try to energize using local state resources to be able to generate more money in the economy in this challenging time and keep more people at work. In addition, National Guardsmen supported movement of telephone lines, technology, and equipment at St. Francis Hospital to prepare for our COVID hospital should we need that support. Also, in the last 24 hours, with our local public health partners and our state public health partners, we conducted 266 engagements related to contact tracing and epidemiological support. In addition, as the governor mentioned, we supported Kanawha County with the testing at Eastbrook Nursing Home, and will continue to provide support in epidemiology to Kanawha County in a surge capacity. We clearly understand the governor's direction for our mission at Workforce, and will effectively, with our partners, execute that mission so that we take care of the citizens of West Virginia. Thank you.
Thank you, General Hoyer. Now let's go to Dr. Clay Marsh, our coronavirus czar.
Well, thanks. It's great to be with everybody today. And I'm going to very briefly mirror the governor's comments that, because of the aggressive actions of the governor and of the leadership group, we have been able to reduce our percent positive of COVID positive West Virginians significantly, and in many ways are among the brightest stories in the country that way. We know that the COVID virus is a virus that spreads easily, though, and as the governor said, we have to be careful not to be complacent. Our power, and we're executing that, is to stay apart, because that starts to reduce the ability of the COVID virus to spread quickly. People have reached out and said, well, we're seeing more positive cases. Is that worrisome? We knew to begin the whole experience in this pandemic that we were going to see people that are going to test positive in West Virginia. It's not really surprising that the first area that we saw that was getting to have more cases was the Berkeley-Jefferson County area. Certainly the Washington, D.C., Baltimore area, which is juxtaposing those counties in the Eastern Panhandle, are areas that are heating up related to the COVID virus infection. And so it's natural that the virus would not really respect state lines and would come over. Similarly, as we look at Mon County, which is close to Pittsburgh, which is a hot spot in Pennsylvania, certainly people coming back and forth in that area, as well as having a large university, would be a likely area for positivity to happen, as well as Kanawha County, which is the seat of our state government and is a business center for the state. But importantly, as the governor pointed out, our percent of positives is still relatively low. And on a per capita basis, on a population basis, we're testing about average in the US. So even though every state would want to test more and to know more about their patient, their citizens, and know more people that would be positive, so that appropriate actions could be taken related to surveillance and to coming up with different care models. That is something that is becoming broader in its rollout across the country. And that's really the reason why doing what every West Virginian is helping do right now is so important. Because you could argue that really we are using our power to try to reduce the impact of the virus. And I think we're doing that very successfully. And I also want to congratulate all of our citizens. But we know that that still means a lot of people will not have immunity to the virus. And right now we don't have a vaccine or a drug. But by creating the opportunity to save lives and improve the health of our citizens, we do buy ourselves more time so that we can start to benefit from the drugs that are being actively evaluated for the COVID-19, as well as other types of approaches like a vaccine a lot of work for that is being accelerated. The other thing that I think is important for a lot of people, this is a scary time. This is a once in a lifetime event. We don't understand it as well as we will understand it. And we're learning about this virus all the time. But I think that the key is, instead of focusing on what the future looks like and the uncertainty, I think it's also important for us to realize the incredible gifts that we're given. And people in West Virginia may remember those better than most people in the rest of the country. And I think the reason why we're doing so well is because we're able to pull together. We're able to help each other out. We're able to understand that by each of us working within our ability to use our power against the virus, we're not only protecting ourselves and our family, but we're protecting our community, our state, our healthcare workers. And so for the group here at this press conference, we are working very hard to look at all contingencies. We are very, very proud of the work that's gone on in this state, and we believe that you have done a great job. But it is our duty to also make sure that we plan for any contingency. And I just want to let people know that we are preparing ourselves in case we have patients that come to the hospital, which we believe we will. We are preparing ourselves to try to outfit our healthcare workers, our essential workers, our first responders with the appropriate protective gear. And we're working to be able to recycle that, decontaminate that gear using very advanced approaches. And we're also looking at creating a way that we can help people stay at home and be helped and be guided, as well as trying to understand where things might be heating up even before we get the positive results back. So West Virginia, you're doing great. I'm so proud of our leadership and the decisions that have been made. I think they've been exactly right. But this is not just a focus that needs to be kept right now, but we need to stay the course, and we need to keep our power, stay strong, and working together. I think we're going to make a huge difference, and lots of people are noticing the great work going on here. So thank you.
Thank you, Dr. Marsh. We'll now go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Thank you. Good afternoon. I'll follow up just briefly with what each has said so far. We are doing well. The numbers look good. West Virginia is positioned well. The governor made decisions early on that many saw as unnecessary and are now seen as critical and essential to fighting this disease. And West Virginia is proof that we've done this the right way and at the right time. But as others have said, we truly do not want to relax. The predictions that we have and the projections that we're looking at are essentially a midline, and we hope we get by with less cases than even the predictions show. But there's also a range there where we could end up having more cases, several outbreaks in a row, and we could end up with numbers that we don't want to see. So to echo what General Hoyer spoke of briefly, we are working on surge preparation. We were trying to get all of this finalized this week. We will be able to provide documents and at least a plan that can be reviewed. But we're working with FEMA, we're working with General Hoyer and the Guard, and we're going to have St. Francis, as he mentioned, set up as a surge hospital, a COVID positive hospital to take patients should our existing hospitals need that. But I want to say finally that I want to thank all of our partners out there in the private sector, the hospitals, the long-term care facilities, and we'll talk about that more in the coming days, are stepping up and helping us to prepare a plan that in a worst case scenario, we will make sure our citizens have care, and that's our priority. So thank you.
And I'll share a little bit about testing, et cetera. The governor has shared our figures with you, and that's great. We look at the number that have been tested. It's actually a minimum number is what you see on the website, because there are laboratories that are not able to electronically report to us the negative numbers. So there's actually more individuals than that have been tested, which actually speaks even more strongly to the strength of the numbers of being that under 4% cumulative positive rates. That's a little bit of an overestimate. So that's actually very good and reflects the good work underway. It's important to remember that not everyone needs to be tested here or nationwide to manage this disease. 80% of folks will have mild to moderate disease, handle that at home, do well, or with their physician as an outpatient. And so it's important so that if you do have disease in the next few weeks, that you treat it accordingly. So that means staying home until your symptoms really are resolving. You are feeling better until you've been at least 3 days without a fever, off of fever-reducing medications, and that you've been home at least a week, so at least 7 days. So the minimum you should be home if you're sick is 7 days. And so the majority of folks will get through things fine with that. If you have symptoms that are worrying you and you're getting sicker, you need to talk to your healthcare provider, talk to them and make a plan accordingly. Do they need to be seeing you, et cetera? So those are just important practical guidelines. I think we are practical as a state. Our residents are very practical. They know how to handle these kinds of things. The other question that comes up sometimes is the difference between the local data and the state data. And again, there is a little bit of a lag time there because we get some data immediately from the lab report electronically, and those show up regularly on the website the same day there. But there are others that come in that do not come in that way from laboratories. They cannot, and they actually come in from the local health department as those cases get uploaded and introduced. So that is actually, as the investigation is done, that data gets more and more accurate. So each day, as each day passes, the data from the cases a few days earlier gets more and more accurate in the system. The last couple of things I'd speak to is that the local health departments are very actively and doing the case investigation, contact investigation. They, in accordance with with support of the regional epidemiologist and the state, really are taking the lead in all of the investigations and contact tracing. We really appreciate the support of the Guard in that work as well. It's really nice to have a force multiplier with that. And then the last area is to speak to the fact that we want to make sure we have a good understanding of the impact of this disease on our healthcare system. And so we are working with the Hospital Association to have kind of a capture a point in time picture each day of how many individuals are in the hospital with COVID-19. And so we will be sharing that with you as well in the days to come. I'm going to send it back to the governor.
Thank you, Dr. Slimp and Secretary Crouch. Our first media questioner today will be David Beard with the Dominion Post. David?
Hi, David Beard. This question is probably for Dr. Marsh or for Secretary Crouch. It comes to us from some readers regarding the UW model and the projected mid-April surge or peak. They're asking us if this means they might be able to consider congregating and holding high school and college commencement ceremonies in May.
That you,
Governor.
Answer it, because I'd love to answer it. You know, we're doing a whole lot more than crossing our fingers and hopeful of just that. And every day that goes by, we have more hope, but we've still all got to be really concerned and continue to stay the course. But nothing in the world would tickle me more. But I think at this point in time, it's all of us. There's still so much uncertainty that it'd be difficult for any of us to answer with certainty.
Okay, thank you, David. Up next, let's go to Kara Lofton with West Virginia Public Broadcasting.
Hi, Kara Lofton with West Virginia Public Broadcasting. This is probably for Crouch or Slimp. I'm curious what directions you're giving addiction recovery centers. I mean, a lot of those are congregate care settings, and additionally, what you're hearing in terms of overdose rates. It's sort of something that has dropped off the face of the news coverage recently, but is obviously still an ongoing problem.
There's, we really should refer to Christina Mullins and Bob Hansen. They've been working very closely with the recovery community to try to really make sure that people are able to still access their services. There have been changes in how those services are delivered, availability of making sure people can still access their medications if they are on MAT or methadone, the ability to do group work virtually and not always in person. The ability to maintain, we do still, of course, maintain our residential facilities and the planning within those facilities around how to minimize the risk of any congregate care setting, so that if it does we do identify a case, we can manage that and handle that appropriately. So it's a critical area and a big area of focus and work that they have really been doing a lot of work in. The broader question of overdose deaths, and I think it's important to think about this. We know that with any disaster, regardless of the type, and especially when they are disasters that are really disruptive to society and very stressful, that we actually increase the risk of substance use disorder, increase the risk of relapse. This is a known and a really worrisome aspect to any disaster, any emergency. It occurs not only in individuals who have existing substance use disorders, but it can lead to new onset of that, especially among some of our first responders and our healthcare workers, and others are at high risk for such things. So really paying attention to the behavioral health and the support systems for our healthcare workers, for our first responders, and for our residents who have substance use disorder and are really trying to work and maintain recovery processes. It's really, really important because we know this is a high risk time.
Okay, thank you. Up next, let's go to WVVA with Jackie.
Hey guys, Jackie Spiger, WVVA here. This might be a tough one to answer, but I'm wondering if Dr. Marsh or Dr. Slemp could weigh in. With the tiger testing positive for the coronavirus at a New York zoo, what does this mean for our pets and the passing of the virus to and from each other?
I can speak just a little bit around the guidance in terms of there is some evidence that some animals can be infected with this virus. It's unclear about the transmission back and forth with humans on a variety of different kinds of animals. There is a recommendation that if you are sick with COVID-19, or you think you have COVID-19, to actually stay away from your cats and dogs in case there could be transmission back to them.
Okay, thank you. Up next, let's go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question for Dr. Slimp. We've heard several times over the past few weeks how important data is in the fight against the coronavirus and COVID-19, about finding sources and clusters and outbreaks. And you've mentioned a few times in your reports that some private labs don't have the ability to communicate electronically with the state lab. And could you expand on that a little bit? Do these places not have email or telephones or beepers or fax machines? I mean, what exactly is the hurdle in getting you guys the numbers electronically? It's hard to understand that.
Thanks, Kenny. Every day, the way that we collect data on infectious diseases from our laboratories, and it's a great source, is we actually have electronic feeds from laboratories. We've got connections with them that allows them to transmit that data electronically to us, so we get a much better picture of what's happening statewide. This is in all of our infectious diseases. So the areas that we have that ability, the labs we already have that ability with, and they were able to rapidly update that to include COVID-19 testing. We are getting those feeds, and increasingly every day we are working with more and more to be able to do that. Because this was a new test and a new system in many of the hospitals and many of the other laboratories, it wasn't automatically in their systems to do that. So we actually are working with other labs to try to get them linked into the electronic feed for this data. And that way we actually can receive the data quickly and manage it and analyze it. Otherwise, we have to receive faxes and enter tons of data by hand, and that manually gets in the way of doing the other outbreak investigation, et cetera.
Okay, thank you. We have time for one more question. Let's go to Aaron Beck with the Register Herald.
Aaron Beck, Register Herald. My question is, The West Virginia Division of Corrections and Rehabilitation has released some general information on how jails and prisons are responding to COVID-19. But what they've released doesn't show how their plan has actually been implemented. It doesn't include specific information on things like their testing capacity, or whether additional cleaning supplies have been provided, or even whether the COVID-19 response team is offering any additional assistance. So I'm wondering if Governor Justice would order the release of the full plan that they have not released yet.
I think Brian Abraham is wanting to answer this question, but if someone else would like to add, okay, Brian.
Okay, so there was a hearing yesterday in federal court that involved Department of Corrections in a case brought by Mountain State Justice. The department was able to establish that they have protocol in place, procedures to handle this, and that they were adequately doing it, and convinced the court that they were able to do that. We can't publicize everything that's going on because there are security concerns within the management of the prison system itself, but rest assured the employees there do have matters well in hand. Secretary Sandy and Commissioner Jividen work day and night to ensure both the safety of the staff as well as those inmates at those facilities. And again, they were able to demonstrate that yesterday.
Okay, Governor, back to you.
Okay, well, just two or three things just on cleaning up, but you know, first of all, for those of you that are seeing the number of positive tests rise, you know, that's correct. But what's happening here is there's a significant amount more testing that is going on, and so we expect the positives to rise. But the good part about it is the positives versus the total tests are still really even decreasing, which is great news. Okay, I've got one thing that has got to be cleaned up, and it's just this, and this is for all of our healthcare people as well as anyone out there from the standpoint of this. If you're being pushed to work and you've got a fever or you're sick, that's just plain not right. And so the end result is, especially if you're one of our healthcare heroes that's on the front lines and doing everything you can possibly do, and you don't feel well, or especially if you've got a fever, we don't want you working, because it's just going to compound the situation. It's going to compound the situation, the possibility for you, your family, any of those, your people that you're working with and everything. And so you've got to know that from the governor's standpoint, I'm telling you that if you feel bad and you've got a fever, no one is going to penalize you, and so you don't need to feel pressured or anything. If you feel bad, we don't want you working. And we need to have your back in every way, and all of our healthcare people and DHHR need to understand and know that we've got your back. We appreciate you in every way, and absolutely as the same is true for just this, and I don't want to go without mentioning just this, on our county levels and everything, all of our county emergency personnel, whether it be the 911 people, it be the EMS people, it be our first responders or our local police, and all those at corrections that are doing an incredible job. We thank every last one of you. You are our first line soldiers and our first line of defense. Sometimes you're not thanked and appreciated enough, and I want to absolutely extend all the thanks I can possibly say and all the appreciation to you for all the great work you're doing. And you're absolutely, you know, you're risking so much by being there and doing what you're doing, and no way we can possibly thank you enough. I want to do one more bit of thanks, and that is to just this, is to a past president of our Senate, Senate President Jeff Kessler. Jeff called me on the phone, and I think it was maybe Friday or Saturday. I can't recall. I think Saturday. And he called me to tell me that he knew of a person that could help us with some additional supplies. Now, you get a lot of calls, and some of them you run to ground, and they come up with who knows what. But we ran this to ground and everything, and what it led us to do was place an order that we think is going to be here in 7 days, maybe less than 7 days, for 500,000 surgical masks and 500,000 gowns. So, Jeff, we really appreciate the call. And Jeff asked me, he said, well, who's going to get to these people and everything? I said, I am. And so I called the first line, and then they gave me to another, and I called him and everything, and off we ran. We got with our people, the guard and everybody, and they did great work and everything. And so the order's placed, and we hope to have 500,000 surgical masks and 500,000 gowns real soon, plus all the other stuff we got working in the pipelines. And the last thing I'd say is just this. For the hot spots especially, that jumped up at us, those 6 counties, please stay the course. All the health officials that are working in every way, absolutely just stay tough and hang in there and everything, and we'll continue to watch any additional potential hot spots that may jump up and everything. But everybody in West Virginia, again, I'm proud of you. Let's stay the course, keep at it and everything. We're going to get there. We're going to win this thing. Thank y'all.